Good evening. Tonight, a teenager in Virginia is dead. His family says the result of a staph infection that resists antibiotics. And tonight, 21 schools are closed because of it. And across this country, the awareness of this danger is now on the rise because it can be a scary, indiscriminate, and silent killer. And it's often discovered when it's too late. So we'll begin here tonight with our chief science correspondent, Robert Bazell.
Today's study finds that a super drug-resistant infection has become so common so quickly that public health officials are calling it an emergency. The infection is staph, a type of bacteria often found on the skin.
In many ways, this convergence of factors is sort of a perfect bacterial storm.
The strain is resistant to most antibiotics. The CDC study found that the strain, unknown a few decades ago, now infects almost 100,000 Americans a year and kills 18,000, more than AIDS.
I don't think anybody really knows why this has become so prevalent so quickly.
But they do know that the infection that at first was confined mostly to hospitals is now spreading, appearing in daycare centers, schools, and other crowded environments. There are often no symptoms, or minor ones that seem like spider bites or boils. The Los Angeles County Jail has had major outbreaks in recent years, frightening the staff.
You definitely don't want to take something like that home to your family, wife, kids, husband, something like that.
The big danger comes when the bacteria move back from the community into the hospital, where they put people at risk who are already sick and highly vulnerable.
Red the monster.
Yeah, Red the monster.
Cahill got a blood infection and almost killed her.
I could not walk, period.
This right here is a culture of Staph aureus.
One major solution: hospitals are becoming far more aware of the danger, constantly monitoring for superbugs. But the major defenses against the danger, in the hospital and elsewhere, are still the old-fashioned ones: cleaning instruments, washing hands often, and cutting down on non-essential uses of antibiotics.
We move now to our collaboration with Google, and among today's top rising searches is the term superbug. Yesterday, the government released a report indicating the spread of a drug-resistant strain of staph bacteria is becoming a serious health problem possibly linked to more than 18,000 deaths a year, including that of a high school student who died Monday in Virginia. What exactly is staph bacteria, and can its spread be prevented? We asked our friend, ABC News medical editor, Dr. Timothy Johnson.
Staph bacteria live harmlessly on our skin but cause serious illness if they enter the bloodstream. MRSA infections are a chronic problem in hospitals where patients often pick up bacteria from contaminated medical equipment and staff. Indeed, the new study finds that 27% of the infections occurred in the hospital and 58% occurred soon after the patient visited a hospital for treatments, such as kidney dialysis or surgery. But MRSA is becoming a problem in the community as well. 14% of patients in the study were infected outside of the hospital. Experts say that efforts to fight these superbugs should focus on hospitals. Vigilant cleaning and hand washing should protect patients during their stay.
We have the headlines and some medical news. The antibiotic-resistant strain of staph infection is causing worries in U.S. schools today. In Virginia, 21 schools have been closed for cleaning, following the death of one student who contracted the resilient MRSA strain of the infection. According to a new federal report, the strain is estimated to cause more than 94,000 infections every year, which researchers say are linked to more than 18,000 deaths. The MRSA strain does not respond to penicillin, but is treatable with other drugs.
Today, that a drug-resistant superbug is more widespread than first thought and may be killing more Americans each year than AIDS. Researchers found that more than 90,000 Americans get potentially deadly invasive staph infections each year. The germ responsible is resistant to standard antibiotics. Experts say the findings underscore the need for better prevention measures.
There's important news tonight about a powerful germ that common antibiotics cannot stop. Experts say the potentially deadly superbug is more widespread than they previously thought and may actually be killing more Americans every year than HIV. And here's what's really scary about this. The germ has spread far beyond hospitals and other medical settings where it's usually found. It may be even in your child's classroom. More on that from CNN's Jason Carroll.
Cleaning crews descended on 22 schools in Bedford, Virginia, disinfecting locker rooms and desks, trying to prevent a deadly superbug from spreading. This after it claimed a casualty, Ashton Bonds, a 17-year-old senior at Stanton River High School.
I was standing beside his bed and I said, Ashton, baby, we're supposed to be having a graduation this year. I said, you got to come up out of this and get better.
Bond struggled for a week before dying from the aggressive infection called methicillin-resistant Staphylococcus aureus, better known as MRSA, a mutated strain of a staph infection. Bond's school had sent a letter to parents warning about the dangers of MRSA.
We have been dealing with MRSA for the better part of the past month, and we have had cases appear steadily since then. We have 6 confirmed cases and possibly 7 within the county.
Late today, Weston High School in Connecticut confirmed one of their students was just diagnosed with MRSA, and officials at Walt Whitman High School in Bethesda, Maryland announced the same. A new government study shows the infections are more widespread than once thought. The study says MRSA may have contributed to nearly 19,000 deaths in 2005, more casualties than those who died from AIDS that year. The study shows the majority of infections, 85%, occurred in hospitals and in medical clinics. But doctors are seeing more and more cases outside medical facilities.
The community is where the epicenter is now. It's shifted from the hospital.
For example, athletes involved in contact sports seem to be susceptible, but some cases seem to defy explanation, like the one involving Simon Marcario.
I remember when he turned 1, I told my husband that I couldn't believe he had passed an entire year without having a sniffle.
But on an April morning in 2004, everything changed. His parents thought he had the flu. Doctors said he was fine and sent him home. Hours later, the 1.5-year-old's breathing sounded odd. His mother called the emergency room pediatrician.
I had her hear his breathing, and she said, hang up the phone, call 911.
Doctors pronounced Simon dead early the next day. An autopsy later confirmed MRSA had infected his organs. Doctors still aren't sure how Simon was infected. Ashton Bond's mother also waits for an explanation. She may never get one. There's still much doctors don't know about MRSA. Only that for now, the cases keep coming. Jason Carroll, CNN, New York.